The future of dialysis is changing, and it's happening now. If you or a loved one has kidney disease, you need to know about the push for more home dialysis. Policies are shifting, insurance is adapting, and this could be the turning point for better patient care. Let's break it down. For years, in-center dialysis has been the default for most patients with kidney failure. But here's the problem. It's time-consuming, disruptive, and often leads to worse health outcomes. Studies show that home dialysis, whether peritoneal dialysis or home hemodialysis, can lead to better quality of life, fewer hospitalizations, and even longer survival rates. So why hasn't this been the norm? Two reasons: policy and perception, but that's changing fast. In 2019, the Centers for Medicare and Medicaid Services, CMS, launched the Executive Order on Advancing American Kidney Health, setting the stage for a major transformation. The goal? To have 80% of new kidney failure patients treated with either a transplant or home dialysis by 2025. Since then, policies have been shifting. Medicare's ESRD treatment choices, ETC model, now financially incentivize providers to offer home dialysis options. The pandemic forced an overhaul in telemedicine rules, making it easier for home dialysis treatments to receive virtual care. More funding is going into patient education and home dialysis training, breaking down previous barriers. One of the biggest game changers in home dialysis is technology. Today's dialysis machines are smaller, smarter, and easier to use than ever before. Innovations like portable home dialysis machines that can take up less space and are easier to operate. Automated systems that simplify setup and monitoring, and remote monitoring capabilities, allowing healthcare teams to track patient progress in real time. These advancements remove many of the barriers that previously made home dialysis seem intimidating or even impractical. But what does this mean for patients? Insurance is catching up. Medicare now reimburses more for home dialysis supplies and training. Private insurers are expanding coverage for home therapies. More flexibility is being introduced into employer-sponsored plans. If you're a patient, care partner, or healthcare provider, now is the time to ask the right questions. Talk to your doctor, talk to your insurer, find out what home options are available to you. And while home dialysis offers freedom, we know that for many patients and families, managing treatments alone can become overwhelming. And that's where Local Home Hemo steps in. Our staff-assisted home dialysis model removes the burden by bringing trained professionals into the home to help with treatments. No more struggling with setup or troubleshooting alone. No fear of missing treatments due to care partner burnout. Peace of mind knowing expert support is not only available, but there with you. With staff-assisted home dialysis, patients get the best of both worlds, the flexibility of home treatment with the support of skilled professionals. Of course, change takes time. There are still hurdles. Not all nephrologists are trained in home dialysis. Some clinics resist change due to financial incentives, and many patients simply aren't aware of their options. That's why we need more advocacy, education, and action. This is more than just a policy change. It's a movement towards better patient care, more freedom, and better outcomes. If you believe in patient choice, share this message. Let's push for a future where home dialysis isn't the exception, it's the expectation.